Let's begin with a framework for constructing your clinical encounters. It proposes 3 phases of counseling. These are explore, guide, and choose. During the exploring phase, using reflective listening and open-ended questions, you gather information from the parent to understand where they are with regard to the behavior or health issue in question. Here, you pull the basic facts of the story, which often includes a discussion of the child's behavioral history, as well as the pros and cons for change from the perspective of the child, the parent, and the family. During this phase, you and the parent together identify what behaviors might be addressed. The emphasis here is on building rapport and communicating that you're not going to push them to change. Once you have obtained the basic storyline, you can begin transitioning toward a discussion of change. This is the guiding phase. Here, we use specific strategies to elicit change talk, such as the 0 to 10 importance, confidence rulers, and the values clarification activity. We help guide the person toward a behavioral decision, though without pressure or coercion. Choosing generally occurs after a person has made a behavioral decision. This is the third and usually the last phase. Here, the focus may shift to making concrete plans, such as setting goals and delineating a specific action plan. As the encounter moves from exploring to guiding and choosing, there's generally a shift from simply listening and asking to problem solving and structuring the behavior change approach. Keep this general framework in mind as we go through the skills and techniques. In the Putting It All Together section, we'll show you how each specific skill is used in each of the 3 phases. After you've viewed the instructional sections of the program, we encourage you to take a look at the Additional Resources section. That will have other materials that might help you successfully master MI. But first, let's contrast 2 different sessions with Donna, the mother of a 6-year-old. In the first session, Dr. Barlow uses traditional counseling styles. In the second, she uses MI.
Okay, so she's had a few days of a runny nose. She had a sore throat last weekend, and now she's coughing.
Yes.
It sounds like probably postnasal drip. I think it's probably just a virus, and I don't think she needs antibiotics. It's not going to do anything.
Good.
But and she'll probably be better by the weekend.
Good.
Before we finish up today, I think we really need to talk about Janessa's weight.
Okay.
According to the chart, she has a BMI of 19, which is at the 96th percentile, which is considerably overweight. And we need to think about getting her weight down. Does she eat healthy? Is she pretty active?
Okay, well, I mean, I don't know anything about this BMI or 96th percentile, but I mean, she's a big bone girl. All of the girls in our family are. I mean, she's active, she's growing, she looks healthy to me.
Well, I think we need to check her cholesterol and triglycerides because at this BMI, there may be some problems already, some serious problems. And if we look at these labs now, you know, maybe you'll start to see that this really is a serious problem.
Okay, I don't know about all that, but I just brought her in here for her cough. Plus, you know, Janessa hates needles, and she was promised no needles today.
Well, I guess the blood work can wait, but we're going to have to get it done sometime in the next year. Let's talk about her exercise. Does she get enough aerobic exercise?
Well, yeah, at school and on the weekends.
Okay.
She sometimes plays with her friends, but she's very active. She's strong.
Okay, but how about her diet? Does she get a lot of junk food or drink soda?
Well, we eat together a lot. And I mean, we only go to the fast food restaurant a few times a week, and she always drinks lemonade, never soda.
Okay, well, you're going to have to cut the fast food down to no more than once a week. And lemonade it's as bad as soda. It's full of sugar, so you're going to have to get her to drink more water.
Well, with the stress at my job and working long hours, I mean, sometimes we only get to eat fast food, and she won't drink water.
Okay, well, do what you can. And tell me about her TV. Does she watch a lot of TV?
I mean, a few hours after school. I mean, more than what I would like, but I mean, I try. You know, kids, they don't listen.
Okay, well, the American Academy of Pediatrics recommends no more than 2 hours a day, so I think we're going to have to get that down to below 2 hours.
Well, that's going to be very difficult because I need that time so that I can catch up on.
Okay. Well, listen, we're going to need to finish up here. I'd really like to see Janessa lose 3 to 5 pounds before we see her again. So let me just kind of go over what we talked about. More water, less junk food, less fast food, and cut down on the TV. Does that sound okay?
Okay.
Okay, thanks for coming in.
Thanks.
How do you think Donna feels about this encounter? Is she likely to change her behavior? As you saw, Donna wasn't ready for the conversation or for the decisions about what to change. She was somewhat defensive and became resistant. Dr. Barlow drove the agenda and decided what Donna should do. She also bombarded Donna with information and questions and missed many opportunities to show empathy, elicit change talk, and build rapport. Now let's watch the scene again, this time using motivational interviewing techniques.
It's a cold. It's a virus, and antibiotics aren't going to help. But I think she'll get better, probably in a few days.
Oh, good.
So.
I'm glad to hear that.
Before we finish up today, I'd like to talk about Janessa's weight and how it might be affecting her health. Is that okay?
Okay.
How do you think things are going in terms of Janessa's weight?
Well, I don't know. I mean, fine, I guess. I mean, she's a big bone girl. Mm-hmm. She looks healthy to me. Yeah. I mean, all of the girls in our family are big bones, so I mean, she looks relatively strong.
So because she's big boned, she may be a little bigger than other girls, but
Yes.
that seems to be pretty normal in your family, and
Yes.
so she seems pretty healthy to you then.
Yes, I mean, she's a little big for her age. I mean, she's 6, but sometimes people think she's a little bit older. But, you know, I don't want her to look too skinny, though, because I think people like that look unhealthy. But, you know, we do have, you know, a lot of diabetes in our family.
Uh-huh.
So
right now, although you're not too worried,
Mm-hmm.
you're really not too worried about her weight. You do want to make sure that the weight doesn't become a health problem in the future.
yeah, I guess. I mean, we've lost a lot of people to diabetes and heart disease in our family. So yes.
Okay. So keeping her healthy and preventing something more serious is something that's important to you. On the other hand, you don't want her to get too skinny. So it sounds like we need to kind of find a balance here between those two things.
Exactly, because I don't want to go crazy with diets and everything.
Sure. Well, if it's okay with you, Donna, what I'd like to do is talk to you about Janessa's weight and where it is compared to other girls her age.
Okay.
Okay? So right now, Janessa weighs a little over 60 pounds.
Okay.
And usually we use BMI or body mass index, which is looking at weight related to height. For girls who are Janessa's age, 6, a healthy BMI is anything 17 or below.
Okay.
Janessa's BMI is 19, which is in the 96th percentile. And what that means is that if you took 100 girls, Janessa's age and height, that Janessa would be heavier than 96 of those.
Okay, but I guess I'm failing to see what is the big problem because she looks healthy.
Right now, you're right, her weight isn't necessarily a problem for her. But actually at this particular BMI, at her age, it's when we start to think about other problems like high cholesterol or high blood pressure. And over time, as she gets to be a teenager, there is a possibility that she could develop diabetes at a very early age.
Oh, I see. So basically, if, you know, we work now so she won't get any bigger, this will prevent problems in the future.
Right, and I can see that that you're really concerned about preventing these health problems down the road.
Exactly.
Okay. What I'd like to do is look at the parent questionnaire that you filled out in the waiting room before this visit.
Okay.
Okay?
Okay.
So I can see by what you wrote that actually Janessa is doing very well with fruits and vegetables.
Yes, she is.
Okay. And she seems to be eating pretty healthy snacks, too.
Oh, yes. I try to make sure I put vegetables on the table, and she seems to like them, too.
Oh, that's good. But on the other hand, there are a couple of areas where there might be some room for improvement. It looks like you eat out at fast food 3 or 4 times a week, and she's drinking sweet drinks 2 to 3 times a day, and the television looks like probably about 4 hours a day.
Yeah. Well, at least with the sweetened drinks, at least it's lemonade. It's not soda.
It's not soda, yeah.
No.
Well, that shows me you're really trying here, and you really are concerned about her health. So,
Definitely.
So I'm wondering which of the things that we mentioned. We talked about TV, the sweet drinks, and the fast food. Which of those do you think we might talk about making some changes?
I would really like to see her watching less TV because, I mean, I've even heard that doctors, think that, watching excessive television actually helps contribute to weight gain. And I don't like the way she, zones out, when she's watching it.
Well, if it's okay, I can tell you what some of the research shows about the relationship between television watching and weight in kids.
Okay.
Okay. So first of all, when kids watch a lot of television, they're exposed to the ads that are advertising the unhealthy food, the junk food. And of course, when they're watching television, they're not getting the activity that we'd like them to get. And then the third thing that happens is that a lot of times when kids are watching TV, they're eating unhealthy food. They're snacking and having things to drink.
And that's definitely not good for them.
It sounds like your experience is like what the research shows, that television is keeping Janessa from being active, and makes her kind of a zombie, as you said.
Exactly. And then it makes me feel like, I've let her down, I'm lazy or something because I've allowed her to watch so much TV. And, I know I haven't been the best role model in that area. And, it just makes you feel really bad, because you're their mom,
So you're disappointed in your role, and you feel like being more active might be good for both you and Janessa.
Exactly. Exactly.
In the second example, Donna was much more engaged and began to consider that her daughter may have a weight problem. The physician noted some things that were going well, used collaborative decision-making or agenda setting, and reflections to acknowledge her barriers to change. This conversation did take a few more minutes than the earlier example, but it generated considerably more change talk. In the next section, we'll review some of the core techniques used during an MI session.